It's a great day to talk physical rehab, and we're going to talk about chronic low back pain and stability exercises for chronic low back pain. One of those exercises is called the dead bug. Now, all exercises have a progression, and it's very important that you, number one, do your exercises properly, and number two, you follow the appropriate progression. You don't want to do an advanced exercise until you can, unless you can do it at a more elementary level, because then you build properly and you don't develop poor mechanics, poor technique, and end up hurting yourself. So the dead bug progression can be done one of two ways. Now, we have another video called lower cross syndrome. That's the dead bug progression in flexion, which means bend this knee and bend this knee, okay? So if Warren were to flatten his back against the table, his lumbar spine's in relative flexion, okay? He's flattened this. Let your lumbar spine come up into neutral. Okay, that's it, neutral. A little bit of a curve. Sometimes we want it in neutral, okay? Push down. Sometimes we want it in flexion. I just had a athlete in today, a heptathlon athlete from college was in, and she needs to do this exercise in flexion, all right? So that's my job, is to decide whether it's in flexion or neutral spine. But what's the dead bug progression? First is to raise your arms straight up and hold the legs up like that, keeping the spine in proper alignment. If I want you in flexion, put the feet down for a second, Warren. Go into flexion, push down, hold that there, then bring it up. His back's flat, okay? Relax. If I want Warren in neutral, right, just right there, neutral spine, lock that in, tighten your abs, bring the legs up, and he's not creating excessive arching. So it's all about what we want to create. The key is no motion occurs here once you set it. If I'm going to date myself, it's like the Ronco, set it and forget it, okay? You got to set the abs. Once you're here, you practice moving just one arm. Go ahead, just move it up. Not allowing this to move at all. And come back, move the other arm, not allowing this to move at all, whether it's in flexion or neutral spine. Then move one leg, perfect. Then move the other leg. When you can do individual arms and legs, then you can do opposite arms and legs, right? Keeping this completely locked in. I'm going to open this up a little bit, Warren, okay? Go ahead. Look at that. That's great. Great technique. Nothing's moving in through here. That's what we want to see, all right? So that's your dead bug progression. Excellent exercise for chronic low back pain. You can relax, but remember, be careful. Make sure you do them right or don't do them at all. And chronic low back pain responds to a multimodal approach. That's what research says. Flexibility exercises, stability exercises, lifestyle changes, diet, nutrition. You got to do it all, and it needs to be managed. But you can get your life back with chronic lower back pain. I'm Dr. Donald DeFabio. Thanks for tuning in.